Hello everyone, thank you for visiting my video. I'm a student for Masters of Health Administration at Penn State University. In this video, I will be talking about mobile applications for the healthcare industry. By the end of this video, you will be able to tell me two things. One being how healthcare applications or mHealth apps are efficient and why these apps improve efficiency. By definition, mobile application is a software program that runs on a smartphone, tablet, or other portable device. Unlike integrated software systems that are generally found on PCs, these apps provide limited and isolated functionality such as a game or a calculator. Even though applications may have avoided multitasking because of limited hardware resources of early mobile devices, their specificity is now a part of desirability because they allow consumers to handpick what the devices are able to do. Common users of mHealth apps are hospital administrators and medical providers such as physicians and nurses. I'm going to throw some numbers that were published by PricewaterhouseCoopers or PwC to discuss the benefit of knowing how and why these apps are efficient. The study done by PwC states that the key drivers are 56% of physicians use mobile application to deliver their healthcare services for making medical decisions. 39% that claim that such technologies help reduce the time for administrative tasks. 36% of healthcare providers believe that they can increase the collaboration among their colleagues through mHealth apps. Last but not the least, mobile dependency is rapidly increasing in today's day. There are way too many mHealth apps with different features in market that have been helping hospital organizations with their efficiency. However, I will be only focusing on 3 features that help mHealth apps being efficient. First and foremost, some of these apps provide secure messaging systems that are HIPAA compliant. One of the examples is Practice Unite, which provide HIPAA compliant secure messaging system. Using a single app, healthcare systems can connect a network of clinicians with patients and manage all their inpatient, post-discharge, outpatient, and community outreach communications. Second, it helps organizations track the time spent by the visitors or staff at various locations. Last but not the least, some of these apps, such as wayfinding, help by deploying beacons and geofences around certain areas. I will now get into why these mHealth apps are efficient. The mHealth apps, such as Practice Unite, make communication easier between teams with easy access to the mobile device. To quantify the effect that communication breakdowns could have on health systems, the Joint Commission, a healthcare system standard and oversight organization, has indicated that nearly 80% of serious medical errors and medical mistakes are caused by poor communication between healthcare providers or healthcare teams. Communication breakdowns in healthcare affect teams and their patients at every stage of care process, from diagnosis to treatment. Without a network to enable rapid connectivity and remote communication, clinician efforts are hindered, while quality of care, patient satisfaction, and cost efficiency suffer. In any industry, communication is always a challenge, as no matter the sector, communication is the key to hold together the workflow. Second, these apps, such as wayfinding, help improve patient throughput and optimizes clinical workflows. Apps like wayfinding tracks the time of each user, whether it be a patient or a provider, and where they have spent their majority of the time. This data collection then helps facilities predict a plan for and around this optimized condition. Third, these apps help with patient safety. Again, wayfinding helps with patient identification. Once a patient is on the premises of the organization, she is recognized by the app, then the app tracks his or her subsequent encounters and all the related workflow throughput the hospital by the help of beacons that have been deployed around the organization. This then ensures patient safety because as soon as a patient with the mobile app is out of its confined geofenced area, the staff is notified when the app is disabled. One of the mHealth apps that stuck out to me was the Practice Unite that is used by Liberty Health Jersey Medical Center. As discussed earlier, Practice Unite is a HIPAA-compliant messaging app that helps with communication. According to Business Wire, the organization has been doing exceptionally well since the implementation of the app. It has been positively impacting the organization's observational unit. It improved communication, has increased the discharge rate, which translates into $720,000 per year savings for the hospital. The app has reduced communication delays. According to the CEO of Practice Unite Communications, responded 6 times faster. Surgeons report consult responses times were reduced from 2 to 4 hours to 15 to 30 minutes. Lastly, it has decreased referral leakage. This saves the organization roughly $120,000 per active physician's user in referral leakage. This app is a perfect example on how and why mHealth apps are efficient. Another example that I will be discussing in this video is the wayfinding app that is used by Mayo Clinic. The app provides GPS, which helps the patient to navigate around the organization easily. Once a patient is in the premises of the organization, she can check in through the app, and then the patient's all other activities are tracked with the help of Bluetooth beacons that are spread throughout the organization. These activities are recorded in a form of how much time does each user, both providers and patient, spend at each location. The data is then used to optimize the clinical workflow to help provide efficiency. To summarize the video, mHealth apps have a secure messaging system which allows users to communicate effectively. Healthcare applications track where users spend their majority of the time, and this data collection then improves patient throughput and optimizes clinical workflow. Deployment of beacons and geofences help ensuring patient safety. Thank you all for watching my video. Hope this video gives you a better understanding on how and why mHealth apps are efficient and organizations need to adapt to these. If you have any other questions, you can contact me via LinkedIn.